Now let's see cardiac tumors. As we know that tumors are an accumulation of cells that are dividing uncontrollably and serve no purpose actually, but if they're malignant they can spread to other areas, and if they're benign and present at the wrong place they can still cause problems. So here let's talk about cardiac tumors. Now as we know that cardiac myocyte is a permanent cell, that is if it undergoes death it cannot regenerate, and we cannot have other cardiac myocytes after a certain age. But what happens is that if we're talking about cardiac tumors, that means cardiac cells are dividing uncontrollably and forming tumors. But that is not the case. Primary cardiac tumors that occur, they are not from myocytes, cardiac myocytes. These tumors occur from other supporting cells of the myocardium. So once we're done with that, we need to know that mostly the tumors in the heart occur due to metastasis. That is, a cancer is somewhere else in the body and it has traveled through the lymphatic system or the bloodstream into the heart. It can either go to the pericardium and it can also go to the myocardium. Now with that aside, let's see some primary cardiac tumors. The most common primary cardiac tumors in adults are myxomas. How do myxomas occur? They occur from mesenchymal connective tissue cells. Now these are supporting cells. These are not from myocardial myocytes. Okay. Grossly, these tumors may be sessile, that is, they might be attached to the wall and they might not be able to move, or they can be pedunculated, that is, they might have a stalk like this. They can be globular, hard, myxoid, that means gelatinous, or papillary like papillae. So microscopically we are going to find stellate mesenchymal cells which are embedded in a mucose polysaccharide matrix. So basically that is all about myxomas, and their symptoms are going to depend on their presence actually. So if they're present here, let's say this is the left atrium, this is the left ventricle, this is the mitral valve, and say it is present here, so when atria are going to contract and force blood here into the ventricle, this might block this and we can have periodic attacks of syncope. They can also cause trauma to the AV valves because this might be coming continuously in contact with these walls. And these tumors can also dislodge from here and go into the systemic circulation, causing embolization. Second tumors are lipomas. We already know that lipomas are benign accumulations of adipose tissue, and these symptoms will also depend on where they're present, if they're encroaching on a wall, or if they're so deeply present within the cardiac structure that they are affecting the conduction pathways. Next we have papillary fibroelastomas. We can see that these are basically sea anemone like lesions. Characteristically they are present on the walls and they can cause embolization. Rhabdomyomas are the most common primary cardiac tumor in children. Okay, these are actually benign hamartomas of cardiac muscle. Hamartomas are actually non-cancerous tumors which are made up of abnormal tissue. So we do not have normal tissue in these tumors. These cells do not resemble any normal tissue in the body. They most commonly occur in the ventricle, and they're usually associated with tuberous sclerosis. This is actually a genetic disorder which affects cellular differentiation, proliferation, and migration early in the developmental stages. They are normally associated with TSC1 and TSC2 tumor suppressor gene mutation. So this gene is not going to function and tumor is going to form. Lastly, just to mention angiosarcomas and rhabdomyosarcomas, which can occur anywhere in the body apart from cardiac tissue. These are two malignant tumors that can also occur in the cardiac tissue. Now let's see some non-cardiac neoplasms that metastasize into the heart. So as I said earlier, that metastasis is more common than primary tumors. The most common carcinomas that normally metastasize to the heart are, the most common one is lung, then lymphoma, then breast cancer, leukemia, melanoma, liver, and colon cancer. So it depends if the cancer spreads via the lymphatic system or the blood. If it spreads via the lymphatic system, then mostly it is going to cause pericarditis and pericardial effusion. That is, it is going to involve the pericardial cavity. But if it metastasizes through the blood, it is more likely to go to the myocardium. That's all about cardiac tumors.